Hello, welcome back to BDO Facebook Live. I'm Monica, and today we have the pleasure of sitting down and meeting with Dr. Edith Mitchell, MD, Clinical Professor of Medicine and Medical Oncology. Thank you so much for meeting with us today.
Well, thank you very much.
Yes, I'm so excited to be speaking with you.
Thank you.
Of course. So
And I'm excited about being
good. Good. Can you tell us a little bit about yourself?
So I am a clinical professor of medicine and medical oncology at the Sidney Kimmel Cancer Center at Jefferson and the Sidney Kimmel Medical College at Thomas Jefferson University.
Very nice.
I head the Center to Eliminate Cancer Disparities. So my work deals with cancers in various populations, genomic profiling, and how we can improve cancer outcomes and decrease the incidence rates as well as the mortality rate, and especially in different populations. We also do genomic profiling so that we can identify the characteristics of tumors,
Yes.
the characteristics of cancers, so that we know which treatments might be effective and those that may not. So it's really trying to make sure that every patient gets the right treatment to the right patient at the right time.
Oh, it's such a process, I'm sure.
Yes.
Yes. So, what are some of the latest developments with cancer in the Black communities?
So in the Black community, we are especially interested in those cancers that might be prevented.
Yes.
And certainly cigarette smoking contributes to more than 40%
More than
of
40.
all cancers. Yes. We think about lung cancer, but we never really think that there are other cancers that are promoted by cigarette smoking. So prevention is one avenue of our work against cancer. Early diagnosis of others, such as breast cancer, for example, where we can screen for cancers. Also for lung cancer, there are screening procedures now where we may be able to diagnose cancers at an earlier stage. And the earlier we find a cancer, the greatest are the chances that we can totally eradicate the cancer and cure the patient.
Good. I really hope that it's very successful, definitely. So, cancer has no age limit, right?
No.
No, none at all. So even like with breast cancer, that doesn't happen more, or the older you get, it could be at any age, correct?
Breast cancer can occur in many populations and many age groups. We certainly see some young patients in their teens and 20s with breast cancer. So it's very important that every woman examine their breast. And if they find a mass or a lump in the breast, then address that with their physicians, because these young women will not have had an opportunity to get a screening mammogram, and therefore very important that young women address breast self-examination and check their own breast. And if they find a lump, don't let anybody tell you that you're too young to have breast cancer. Get it checked out by a doctor.
Definitely. And how often should you go for this mammogram? Is it yearly?
Well, for most women, we recommend the annual mammogram. Some physicians may, for an individual, order either a mammogram more frequently or other testing that might be important for the patient. So there's no one shoe that fits all, and every woman should work with their clinician or provider to make sure that they are getting precision medicine, meaning that it's right for you.
Definitely. And can men also get breast cancer as well?
Oh, of course.
Okay.
And actually,
That's,
African American men have a higher incidence of breast cancer
do they?
than Caucasian men. Yes.
Wow. Did not know that. Definitely something to
Yeah.
know, something we should be aware of.
Yes.
So men can also go get a type of testing. It wouldn't be a mammogram, I'm assuming. But,
Well, it depends.
okay.
They should check it out with their doctors. If there is a lump on the chest of a man,
Okay. So
and
they should also be
they
checking.
should also see a doctor
Yeah.
so that it can be evaluated.
Definitely. So, is there a way that we can prevent cancer in general, like by
So-
our diets or just anything?
So we think about cancer prevention, but that's really very specific
Right.
in that cancer is not one single disease. It accounts for many different diseases, some of which we don't even understand what causes the cancer, and therefore preventive strategies haven't been defined.
Okay.
However, cigarette smoking,
Right.
as I said, is the one thing that everybody can do to decrease the incidence rates for a number of cancers. Others, diet can be very important, and so should we think about obesity
Yeah.
as being a major contributor to certain cancers. There are also some cancers that are inherited
I was going to ask that,
and
yes.
passed on from one generation to the next.
Okay.
So we should know our family histories
Definitely.
and know
Always
if
important.
there have been any cancers in the family, and there can be appropriate screening and testing done. Colorectal cancer, for example, can be prevented by screening,
Yes.
and by screening we can diagnose polyps.
Oh, okay. Good.
That can be removed, and once the polyp is removed, it cannot develop into a cancer.
Oh, okay.
And we can find out a lot of information about the individual's risk factor for developing cancer. For example, if there is a history of colon polyps, then the gastroenterologist might recommend colonoscopy more frequently so that other polyps can be removed. So it's really sticking with your physician or medical provider so that you understand what is recommended for you, because there is no one recommendation that is made for all individuals. Everybody is different.
It's different.
Everybody's risk factors are different, and therefore the things that we can do. But in general,
Yes.
cessation and quitting smoking, a proper diet, some exercise, at least 150 minutes per week,
Per week. Okay. It's not too bad.
and that should be divided, between 30 minutes daily. So not 150 minutes
right.
at
All
one
at
time.
once. Right.
A diet
Mhm.
that is rich in natural foods, fresh vegetables, fresh fruits, low in saturated fats. That can be very helpful, and then just watching the size of the waistline.
Right.
So making sure that one is within their recommended weight.
Right. So going back to the polyps,
Yes.
once you get that removed, is it removed for good, or can more appear like
More
later in life?
polyps can appear.
Okay.
The polyp that is removed can't go back.
Okay. Okay. But
Okay.
another one may appear.
Another
Okay.
may appear, and there may be some proliferation of others. And there are other characteristics of the colon that the gastroenterologist can see that might give a clue to a risk
Right.
of developing colon cancer. But no,
But no. Okay.
once the colonoscopy is over,
Yes.
the polyp is removed. That polyp will never form a cancer because it's out.
Gotcha.
Okay.
So what are, I would say, what are the top most deadly cancers?
Well, we don't classify them as being deadly. Some cancers are more difficult than others to treat.
Okay.
And even when you talk about cancers, let's say lung cancer,
Yes.
there are some lung cancers that are more aggressive than others.
Okay.
There are some breast cancers that are more aggressive than others. So it's not really important to think about liver cancer being more aggressive than
Okay.
ovarian cancer
Just
or
depends.
another cancer, because each cancer is evaluated under the microscope and with other technologies to define how aggressive that cancer is, what are the characteristics of it, and not only that, but that helps us define treatment parameters as well. So we don't want to think about one cancer being better than the other,
Right,
or not
right,
as
yeah.
aggressive as another.
Right.
Each individual cancer has its own unique characteristics.
Okay, thank you. And so right now in your work, what are you most excited about? What's going on?
So one of the very exciting areas of oncology now, besides the fact that we have better radiology and we can find cancers on various scans much more readily, so we're excited about better diagnostic tools. There are better laboratory tools that we can define receptors that are on the cancer cells, and those receptors allow us to help define targeted therapies and treatment parameters. And that has also allowed for the development of immunotherapeutics, meaning drugs that might improve the body's immune system to isolate the cancer and prevent growth. So
Okay.
immunotherapy is a
Yeah.
newer technology that is really growing, and we're defining better tools for immunotherapy, and then combining immunotherapy with standard therapies such as surgery,
Okay.
chemotherapy, and radiation. So it's combining those therapies and the effectiveness of various combinations of therapies as opposed to a single treatment.
Right. Very nice. That is something to be excited
Oh,
about.
it's really exciting, very exciting.
We have a question?
Can you talk more about the treatment options for cancer now and just the developments and the effectiveness of them?
So, the treatment options for various cancers depend a lot on the patient as well as the tumor and what the patient wants. For example, for many individuals, especially those who are over 50, might have other medical conditions, some lung problems or hypertension or diabetes or other medical problems that may affect treatment and therefore be entered in what we call the treatment plan.
Okay.
So the treatment plan looks at the total patient. And there is no one therapy that works for every cancer or for every patient. So for each patient, we design a treatment plan, and that treatment plan incorporates, first of all, what do we know about the cancer? How extensive is it? Has it spread to other parts of the body? And the type of cancer. Then we look at the individual patient. What kind of medical problems do they have at the time of diagnosis, and how we need to incorporate whether they've had a stroke in the past, or heart disease, or lung disease, or diabetes, hypertension, or high blood pressure. So all of that is entered into the treatment plan.
Okay.
And that treatment plan, depending on the type of cancer, what are the characteristics of the cancer, has it spread to other places in the body, and we define a treatment plan. So that treatment plan could include hormonal therapy, such as for breast cancer, surgery, radiation, chemotherapy, immunotherapy, or some combination of them for every patient. So we don't even define, well, what are the treatments for cancer? We define what is the treatment plan. So every patient is evaluated. Every patient has had their medical problems already defined and included in the treatment plan. So we're taking care of the whole patient.
Good.
And not only that, we are now looking at financial toxicity, as we call it, meaning what are the patient's resources for treating the cancer and covering the cost of care, but also let's say, for example, a patient works, and if they don't go to work, they don't get paid.
Right.
So we look at how can we facilitate the ability of the patient to come for treatment. So in many centers, and at Jefferson, we have extended our treatment hours to evenings, early mornings, and 7 days a week.
7 days.
So for individuals who, let's say, have to work Monday through Friday, they
9
can
to
come
5,
in
right.
for Saturday or Sunday treatment,
Good.
or they may be able to come in after hours, after 6, after the usual workday. So we're extending our hours. We're doing everything we can to make access to care
Good.
improved, and therefore allowing more patients to get the treatments on time, at the right time, and therefore have a better chance
Yeah.
of cure of cancer and successful treatments. So we say successful treatment outcomes.
Right. And so I'm surprised that I think most centers don't have these extended hours.
Well, I won't talk about what other
Well, yeah.
centers do,
But I mean,
because
it's very
every
nice that
health
you guys
system,
do.
every health system has its own strategies and plans. But there are many centers moving toward those type of arrangements
Yeah.
to make the treatment more accessible to patients.
Very
So yes, we
That's
have
good.
treatment after hours,
Right.
and treatments Saturdays and Sundays.
Very nice. I'm sure everyone appreciates that. Do we have any other questions? Online questions? All right. Well, I do want to ask you, you are receiving an award coming up, aren't you?
Yes.
Yes. Can you tell us what that award is?
Well, I really like for the university to
Okay.
address that.
Okay.
But what I would suggest, you look online and look on the Jefferson website
Okay.
for the Jefferson Gala.
Okay. And when?
And it is October 30th. And I am very privileged and very honored to be the faculty member who is honored at that event. So I'm really excited about it.
Very nice. Good. And an early congratulations.
Oh, thank you.
Of
Thank
course.
you.
And we'll
Thank
be
you.
tuning in, definitely, to
Thank
see
you.
receive your award. Now, would you like to tell us about the website that we posted up here? The Jefferson
Oh,
website?
the Jefferson website. So our motto is until every cancer is cured. So we work with our community, so we know what cancers are very prominent and occur more frequently in the community, and we address the issues for the community so that we're more accessible. And just as we have the technology and procedures that occur in the evening, we want our patients to have the advantages of those things. So it's until every cancer is cured. So we work with many organizations. And you can see we have research, patient care, academics. And academics involves teaching and teaching others, not only physicians, but medical students, nursing students, pharmacists, and other healthcare providers. So we have a large university and university center where we're providing the education of all of those individuals. We also provide education for physicians who have finished training many years prior and are in practice, so that it gives the practicing physician access to education on the newer techniques and newer technologies and pathology. We have consortium partners with many health care institutions in the local area. We have clinical trials on the right side, and how individuals can make an appointment. So you can go to the website and click on any of those areas. And then we have support for SKCC, Sidney Kimmel Cancer Center, and that's for patients who might have questions about transportation to the center. What are our hours? Can they get a CAT scan?
Okay.
Or an MRI,
You just
a
ask
mammogram,
all questions.
colonoscopy?
Yeah.
All of those questions can be asked
Oh, good.
online and answers. We also have a telephone number. It's 1-800-JEFF-NOW. 1-800-JEFF-NOW. So if one does not have access to the web,
Just call. Yeah.
1-800-JEFF-NOW.
I love it. Oh, we have one more question.
Yeah, one of the viewers wants to know, when you're done with your treatment, do you have to do CT scans forever or just for the next 5 years?
Just as every cancer is different, the follow-up after successful treatment can be very different, and it is. So there is no one set guideline or rule for how many CAT scans, how frequently. For some patients, we don't need to do CAT scans frequently, or maybe not at all. So it depends on the type of cancer.
Thank you so much. I want to let you guys know that BDO will be launching a cancer series taking an in-depth look at cancer. So that will be coming up, you guys. Stay tuned for that. Dr. Mitchell,
Thank you so much. It's so important that we all learn about cancer and know the fact that overall, cancers occur more frequently in minority populations, especially the African American population. And in fact, African American men have the highest incidence rates and the highest death rates of any population in the United States. So therefore, it's so important for us to take care of our families, have our family members evaluated and screened for cancer, so that for those cancers that we can screen for early and diagnose early, it's very important. But it's also very important to look at our prevention and make sure that we are preventing cancer. And the most important ones, as I said, cessation of cigarette smoking, diet, and a healthy diet, heavy in fruits and vegetables that are fresh, low in saturated fats. Exercise, and speak with your doctor about what else you can do. For some individuals, we'll recommend aspirin as a preventive strategy, but I don't want people to just start taking aspirin. I want them to talk to their doctors about any medication.
Of course. Thank you so much.
Thank you. It's a pleasure being here.
Yes.
I'm always happy to talk with someone from blackdoctors.org.
Yes, and hopefully we'll definitely have you back. You guys, don't forget, if you have any questions, all things cancer, please email feedback@blackdoctor.org. Again, it's feedback@blackdoctor.org. Thank you again, Dr. Mitchell, and
Thank
we'll
you.
see you guys soon. Bye.